started. Okay, this PowerPoint goes over human trafficking and the health concerns that are associated with it. The population of human trafficking can be anyone and everyone. Human traffickers do not care if you're male or female, if you're old or young, if you're what your sexual preferences are. They just want people to traffic and to get their needs taken care of. If people are living in poor areas, they're homeless, they live in unsafe situations, these people can be better targets for the human traffickers. So that is the population. As far as population size goes, I've split this up into different areas. Weber County was very difficult to find a statistic on. I looked for over an hour for human trafficking in my local area, and I couldn't find it. But in December of 2020, there were 18 arrests in Ogden, Utah. 17 were male, 1 was a female. And this was a very good direction moving forward for the human trafficking in Ogden. By arresting this many people, there was a huge stop to it, but that also doesn't mean that human trafficking is not occurring. It also means that if there were 18 people who are arrested, that's quite a bit going on. As far as the whole state of Utah, there were 64 cases reported in the year of 2020. That doesn't necessarily mean how many victims, that's just how many cases were reported. And nationwide, there were 16,680 individual victims in 2020 and 24.9 million victims globally as of 2017, which means that number could have probably increased since then. That's insane. As far as the social determinants of health go, I decided to use the neighborhood and built environment determinant of health. You can relate many others to this, but I decided to go with this one because if people are not living in safe areas, they may participate in riskier employment or with riskier friendships to be able to provide for themselves. And that, as I mentioned previously, is kind of a target on people's backs to the traffickers to get them into human trafficking. This also said, I also found something that said 1 in 5 children who live in shelters report some involvement in human trafficking. So because these kids aren't living in safe homes and in safe environments, they are more at risk for being involved in trafficking. A root cause of human trafficking, I kind of feel like that goes hand in hand with that last little bit, is their safe living situations in their neighborhoods. But I want to dig into that a little bit deeper. Human trafficking is a business to the traffickers. They deal with drug smuggling, sex trades. They deal with physical labor, trafficking. And so they find the people who will be easy to get involved in this. Individuals who are feeling stressed financially, who don't have the proper living situations, who don't feel comfortable with who they are or where they're at, who are feeling down on themselves, these are easy targets because the human traffickers are very good at using coercion and deception to get these people into human trafficking. They promise them safe homes, they promise them money, they promise them modeling gigs, they promise them love, and all these things that these people want. And so obviously they're going to go for it, not realizing that they're going into human trafficking. They think they're under the impression that they're getting this help via a safe route. Okay, Maslow's hierarchy of needs. Simply put, none of these people's needs are being met at all. Physiologically, these victims are being forced to have their bodies done or to do whatever these traffickers want them to do. They don't have an opinion or a choice in the matter. So physiologically, that need is not met. As far as safety goes, these people are living in very unsafe and unsettling conditions. They don't know when their next meal will be. They don't know if they're going to be killed the next day. They don't know where they're going. And just the environment itself may not be a safe place to live. As far as love and belonging goes, as I mentioned, they may be promised love and belonging at first, and they may actually feel love and belonging to someone. But as soon as they're a part of the business, that most likely always goes away. And so they're being forced to do sexual acts for others, and they're not being given that love or the sense of belonging that they were promised. Esteem. These people, they are no longer in control of their bodies, and in doing so, the confidence that they once maybe had in themselves, even if it was just a little bit, is probably gone. Maybe even the respect for themselves or the respect from others for them is gone. Human trafficking has been coined as modern day slave trade, and I believe that that's exactly what this is, and it's hard to have a good high esteem when you're being used as a slave. And with none of these needs being met, self-actualization is almost impossible. Okay, diseases and health risks. I decided to put these all together because they kind of all go together depending on the situation that the human trafficker is in, the traffic victim is in. Sexually transmitted diseases, HIV, AIDS, hepatitis, pregnancy, all of these can come via rape. Basically what's going on with these victims. If the people who are raping them are not giving them any type of protection or things like that, or medication to prevent this, they are very much at risk for these to be transmitted to them. Same with rectal trauma and urinary trauma if they are being raped. Various infections can be given to the person, and they probably won't get that best of medical treatment. So say it's a cut or a big laceration and they're not being given antibiotics, that can just get not treated. Respiratory problems, cardiovascular problems, and eye problems can come from the conditions. If they're not being able to breathe correctly, if there's dust and everywhere is there, if it's a dimly lit area, this can all cause problems. Tuberculosis from living in a very crowded environment can be a problem. Untreated diseases that they may have had prior to human trafficking, so cancer, diabetes, if they're not getting their medications to help with that, those can get exacerbated. Serious malnourishment if they're not being fed, obviously. Dental problems if they're not able to brush their teeth. And forced substance abuse is a big thing because these people may be drugged to perform these acts, and if they get out, then they're still going to be addicted, or if they're in, they're going to be addicted. And bruises and scarring from physical abuse, kind of what I mentioned earlier. These people can be affected by that as well. These are my references, and I hope you enjoyed my PowerPoint on human trafficking.